All right, well, welcome back everyone from our break. I'm very excited to get started with the next part of the program. I'd like to welcome Janet Hieshetter and Kimberly Kuman. Janet is the Executive Director of the Dystonia Medical Research Foundation, and Kimberly Kuman is the Executive Director of the National Spasmodic Dysphonia Association. They will be giving us a patient advocacy group update and plans. And look forward to hearing their talk. And I certainly want to extend my thanks to them. There's no way our patient-centered outcomes project would be where it is today without their involvement. So really appreciate that. Ladies?
Good afternoon. It's a pleasure to be with you here today for the annual Dystonia Coalition meeting. My name is Kimberly Kuman, and I serve as the Patient Advocacy Group Liaison. And I also serve as the Executive Director of the National Spasmodic Dysphonia Association, which is transitioning its name to Dysphonia International. We're here to discuss with you the updates and future plans for the patient advocacy groups that support the Dystonia Coalition. This is a list of the current patient advocacy groups that are members, and the ones with the asterisks indicate the ones that were part of the initial application. We're very proud to be part of this program and to be very engaged, both serving on the executive committee and being able to provide support in any way that we can. And as you can see, there's very much an international representation of these patient advocacy groups, and we keep expanding them. There are basically a few key areas of collaboration that we focus on: the organizational and administrative activities, the opportunities for co-funding projects, innovative approaches to patient registries, and also educating our patient community about the work of the Dystonia Coalition. And we'll be touching on these today. One of the other avenues that we work on is the distribution of the recruitment information for the various projects. We provide email and updates and conference calls for the patient advocacy groups. We attend the annual meetings like the one today, participate in the executive committee calls. So again, the voice of the patient advocacy group is represented on these executive committee calls. And we advertise the grant programs and encourage our researchers to participate in both the pilot program awards and the career development awards. And all of the organizations are represented on the Dystonia Coalition website. Some of the patient advocacy grant support comes through the main projects, the pilot projects, the career development awards, along with the travel scholarships for junior investigators for in-person annual meetings. Also, there is scientific representation from the patient advocacy groups on these grant review committees. One of the projects we'd like to touch on is this one on patient-centered outcomes. This project is really driven by the voice of the patient, and we very much appreciate the work of Dr. Sarah Pirro-Richardson for the inclusion of the patient advocacy groups. The Dystonia Medical Research Foundation, the Benign Essential Blepharospasm Research Foundation, and the National Spasmodic Dysphonia Association have all been very engaged in this in collaboration with Dr. Richardson. We very much were part of the organization of the focus groups and the review of the questions so that they really are the voice of the patient represented. One of the other programs that is driven by the patient advocacy groups is our Global Dystonia Registry. This is an internet-based registry owned and funded by the patient advocacy groups annually. We are compliant with all privacy laws, and also it was important that the data fields be compatible with the DMCC registry, so there is synergy between the two. Currently, the list of organizations that are funding it are listed, and we also work with the executive committee of the Dystonia Coalition to serve as our scientific committee. The registry is an important piece to advancing research in that it gives the patients an opportunity to be part of a bigger program, whereas researchers can then reach out to us to have studies advertised. Launched in December of 2011, we currently have over 6,350 people registered from over 90 countries. It's predominantly women, but you can see here kind of the breakdown amongst countries. We are always working to expand and grow this, both from the patient standpoint, but also from the point of view for the researchers, so that they are able to use this more efficiently. Now it's my pleasure to turn this over to the Executive Director of the Dystonia Medical Research Foundation, Ms. Janet Hieshetter.
Thank you, Kim. It's really my pleasure to participate in this meeting and to be here with all of you and provide an overview of the role the Dystonia Medical Research Foundation has in serving the Dystonia Coalition as an administrative center. This slide provides us with an overview of the structure of the coalition, and you can see here that the DMRF is a subcontract to Emory to this grant, and see that we pay out the recruitment fees to all of the sites. We pay the pilot project awards out, the career development awards. We have a role in supporting the development of and the actual logistics of this meeting, the annual meeting, and then take care of paying out other things like consulting costs and those kinds of things. Next slide, please. As we have previously reported, the DMRF really holds a unique role as it relates to roles of patient organizations in the RDCRN in serving as an administrative center for the coalition. We have a memorandum of understanding with each of the 40+ centers. As I mentioned, we pay out, those funds come through us, and because we don't pay indirect, we're actually able to save in excess of, I think at this point it's something like $1.7 million over the life of this grant that's been able to go towards supporting the projects of the coalition. The DMRF receives no financial compensation for our role as administrative center. We're happy to do it. We're pleased that we can do it. We believe very strongly, like the other patient groups, in the work of the coalition. I should say it's not without a great deal of effort and time on our staff part to do all of this. But as I said, we're really pleased to be able to do that. We do organize the annual meeting and then offer to help in organizing any of the other administrative functions that we can for the coalition. Next slide, please. Like the other patient advocacy groups associated with the coalition, we participate in the review of the pilot project grants, the career development grants. I want to thank our chief scientific advisor, Dr. Jan Teller, for his role in this. We also have a separate fund for patient organizations to contribute, not only to help supporting perhaps a career development award or a pilot project, but maybe it's a travel scholarship to a meeting when we had actually in-person meetings. Those funds are sent to the DMRF. We hold them separate from our own funds and it allows for organizations, regardless of their size, to really be invested in the work of the coalition. And then we represent the Dystonia Coalition on the CPAG steering committee. I serve in that role. And I also, like him, am a member of the executive committee for the Dystonia Coalition. Next slide, please. So here are all of the patient organization logos. We have a very active patient community involved in the Dystonia Coalition. I think it's important maybe to say at this point that the beginning of the coalition really had its start with patient advocacy groups. We came together, met with investigators in the community, and really made a plea, recognizing the need for there to be collaboration within the research community, the need for a unified research network. And our research community responded beautifully, and we're grateful to all of you for your efforts with that. Certainly grateful to Dr. Jenna for his leadership with the Dystonia Coalition. Also grateful to everyone who in the work that they do every day in easing the burden of dystonia for this community. I do want to just take a moment though and acknowledge the contributions of one woman who attended that first meeting, and then every meeting thereafter that we held in person. Diane Trong, who was a leader with the National Spasmodic Torticollis Association. Diane was passionate about the need for collaboration, both in the research community and within the patient groups. She was a strong advocate for the dystonia community, and sadly, Diane lost her battle with cancer last month. We miss her very much, but her contributions to this community, to the coalition, and to all of our work will be long felt, and her spirit motivates us still to continue the work that the coalition is doing and the work of all of our respective organizations. So I just wanted to take a moment and acknowledge Diane's contributions to the field. Thank you.
Thank you, Janet and Kim. That was a wonderful presentation. I'll open it now if anyone has any questions or comments regarding this presentation. Yes, Joel.
Yeah, I would just like to make a comment that we really are unique in the RDRCN, and with the amazing support we've had from our patient advocacy groups, from both Kim and Janet and the DMRF in acting as the administrative support for this. This just not would have been possible administratively with all the effort and the huge financial benefit that this is accrued to our research efforts. They're just really to be very well applauded, and all the effort that goes into all of these various components is really an amazing support for all the things that we do together. And this really is collaborative. It is not one directional. It's really all working together for the same purpose. Thank you again for everything that you all are doing.
Yeah, I would just like to echo what Joel just said. This is a real partnership, and it has been from the very beginning with many of our private patient groups, not just financially in terms of saving huge amounts of money and actually adding pots of money to pilots and career development award grants so that we can fund more, but also a lot of support for doing the studies, designing what it is we really want to do and make sure it's relevant from the patient perspective. That has been a huge benefit. Also finding and helping recruit patients for certain kinds of studies. Many of the foundations, patient advocacy groups have really helped for individual studies and getting recruitment really going very nicely. But also for helping us organize and run the whole thing. This webinar in particular, obviously was all set up and organized by Jean M. and others at the Dystonia Medical Research Foundation to make the job of doing the science easier for people like me and Joel and Sarah and others on the panel you see. But their help cannot really can't be underestimated. So thanks again.
Thanks, Buzz and Joel, both for your kind words. I just want to say, serving on the CPAG steering committee, I can attest to the fact that not all of the consortia involved in the RDCRN have the kind of relationship that we have with our investigators. So on behalf of the patient advocacy groups, I just want to thank all of you for your willingness and your receptivity to the patient voice. I think it really has been a very nice partnership that started many, many years ago before the coalition, but certainly the coalition has provided a platform for all groups to participate. So thank you for all of that. Thank you.
And I'll just chime in that I know you quantified some of the help through the financial support, but I will also quantify that during a pandemic, you all were able to rally over 1,000 dystonia patients to participate in our focus groups and in our online surveys over during a pandemic. So tremendous work and effort on your part. Really appreciate it.
Well, and I think it speaks volumes for this community and its willingness to be a part of research and for its interest in research. So, kudos to all of the people who are affected by dystonia and their willingness to try to contribute.
Well, thank you very much. That was a wonderful presentation and such a nice way to highlight this special relationship.